So give 2 months time for 2 IUIs, and then if it doesn't work, move on immediately to IVF program.
What is your suggestion to improve egg and sperm count?
Okay, so like I told you, a low AMH, whenever the egg count is low, the anti-Mullerian hormone level is low. The normal value is 3. But today you're seeing in young girls, you're seeing values like 0.2, 0.3, 0.01, very, very low values. So how to improve this? Normally we give medication, and we give a tablet called DHEAS, and we also give a tablet called coenzyme Q and some gel called testosterone gel. So when all these fail to work, then we have a newest technology using the stem cell, which could be obtained from the bone marrow, or it could be obtained from a stem cell bank, and this stem cell is injected into the ovary along with platelet-rich plasma. You take the blood from the patient, and then you prepare a platelet concentrate, add growth factors, and then you inject the stem cells and the platelet-rich plasma into the ovary. The first time we inject, we do it laparoscopically, because you're able to definitely inject it into the ovary. You're very clear because you're looking and injecting into the ovary. So you're very clear that everything goes into the ovary in the right place. Now currently there is a new technology called ECM, that's called extracellular matrix. So that is also injected, so that you give a nice platform for the stem cells to grow. And when the stem cells grow, it stimulates the little eggs which are sleeping to get up and start working. So this is something new which has come in, and we have found that it gives very good results. When you use a bone marrow stem cells, you have to take the bone marrow from the patient, and you have to culture the cells. It takes about 15 to 20 days, and then after that you plan a laparoscopy to put back the bone marrow stem cells inside the ovary with the platelet-rich plasma or otherwise. So that is also a very good form, because you're taking it from your own body and injecting into the ovary, but both of them give equal results. I tell my patients that bone marrow stem is a little painful to take out the thing. This is painless, so most patients prefer this. But when it doesn't work and you want a second sitting, because all patients, 40 to 45% of patients succeed, and the younger the age and the better the AMH, the better the success rate. If your AMH is going to be less than 0.01 and the age is 45, definitely the success rates will be less, something like 30-35%. So this is something which you have to tell the patient what to expect. In today's age, I think this is a very important technology, because when you see young girls, they definitely don't want to go in for a donor program, because they feel that they are still young and their ovaries can make it. So a lot of patients now go on for this, and the number of patients who actually start using donor eggs, first line they want to try this treatment, and the last thing, if nothing happens, second sitting, third sitting, nothing happens, then they decide to go for the donor program. So this is the way we handle the low egg count. When you look at the sperm count, then the sperm count is improved by giving medication, and at least about 50% of patients may improve with medication. Some men have a condition called varicocele. So these varicoceles, if they don't respond to medical treatment and some lifestyle changes which the andrologist tells them, like to avoid prolonged standing, to avoid stress, to avoid working in hot atmospheres, then you think of doing a laparoscopic ligation of the varicocele. That means they tie up the veins, and this helps it because it helps you to improve the count, it helps you to improve the quality and the movement of the sperm, because this heat which is generated destroys all these things. So when the heat is decreased by tying the varicocele veins, then it helps to improve the sperm count. So this is the way we do it. But sometimes the count is so low, 10 sperms, 15 sperms, then it's very difficult. If it's a little better than that, like I told you earlier, if it's more than 5 million, then you can try an intrauterine insemination. But if it is very low, then you can't wait, and it's important to go for an ICSI program. ICSI means injecting the sperm into the egg directly. Now there are some men who have no sperm at all. So what do we do for them? So initially it used to be go for donor sperm, but today we have many technologies where we try to improve the sperm. Now first you have to find out whether the sperm production is there or not. So we take a biopsy or we aspirate some